Gary, I want to shift just a little bit. There was a recent article in Skilled Nursing News that talked about the crisis that's happening in the post-acute space, and they call it the crisis on top of a crisis, because not only were we seeing significant challenges through the pandemic, but we also started to see staff just not being there anymore. Mm-hmm. And that was a combination of in that industry alone, 240,000 staff were gone. Yeah. And over 200,000 people passed away. That's a combination of patients and staff that have passed away. That 240,000 staff that are gone is the absolute worst in the entire healthcare sector, and that's coming from post-acute. Tell me what you've seen since the start of the pandemic.
Obviously, it's, in my 25-year career, it's something that's never been seen before.
Yeah, I can
for
imagine.
Any of us.
Right.
One day business is normal. The next day, it's like, okay, state health department, it's like, okay, lock your doors, no visitors allowed.
Put the chains on.
The patients were still there. As a staff, we're still there.
Right.
To work with those individuals, very challenging. And I do remember the first time a patient contracted COVID-19 and ended up passing away. It's kind of really brought it very real.
Yeah.
You see it on the news, but until it happens directly in front of you, it's kind of gives you a moment to pause.
Yeah, I can imagine.
To reevaluate, okay, what am I doing? Because you worry, obviously, as a healthcare provider, you worry, okay, am I taking this home to my family? And things like that. But I also know that the individuals we were working with, they needed me as well.
Yeah.
They still had goals. They still had things they needed to accomplish. And their goal was not to stay in that facility. They wanted to go home as well. Mm-hmm. And so it was a challenge. Staffing challenges came and went. Different times you get a little creative, I guess.
I can imagine.
To kind of face the challenges that you come. Healthcare is always a challenge in itself just because you're dealing with a human being. And people are not predictable like a car.
Right.
Things happen. You have to wait.
You can't just check the oil, rotate the tires, and everything's good.
No,
right?
No, you can't. And there's so much of the emotional side of it that comes along. So that was the challenge of they couldn't have their loved ones come visit them. Their loved ones would come up to the window, but that's not the same.
No. When you think about it, so this pandemic hits, right? And all of these challenges dealing with COVID-19, the fear, the scare of, like you mentioned before, are you going to be taking this home, but also everybody in the facility? How do you now quarantine, and how do you get people to where this doesn't infect other people while also achieving the goals and the priorities that each individual patient has? Because if you can't get somebody to the level that they are ready to go home, mm-hmm. they then have to be within that facility, and that's discomforting for them, right?
Oh, yeah, very much so. Yeah, and that's the hard thing. And like I said, communicating with loved ones is a difficult thing. And part of what I do is, working with this individual, it's like, okay, who's going to be there to help you when you get home?
Yeah.
Who's going to be there to, go get some food for you and shopping and things like that. So kind of added a lot to our plate is because normally those individuals would be coming in, visiting the their loved ones, and family would be able to just talk to them face to face. Now we can't do that.